Hi, listeners, and welcome back. Before today's episode, let me remind you about our upcoming CME event, Extremities in the Carolinas, Arthritis to Arthroplasty. This is May 20th through the 21st, which is a long weekend. It's in Charlotte, North Carolina at the Hilton Charlotte Uptown. The focus will be on upper and lower extremity osteoarthritis and arthroplasty, and with the live meeting and successful completion of the accompanying self-assessment exam, it'll be worth more than 20 hours of Category 1 credit. Please hurry and sign up today as space is limited. The orthoPAC, hosted by Sam Dyer. Welcome to the orthoPAC, where we discuss up-to-date orthopedic topics for the busy clinician. I invite you to sit back and relax as I attempt to fill in the gaps between education, current events, and real-world practice. Welcome, listeners. Today I have Dr. Roman Haida. Dr. Haida is a retired colonel from the Army, and he's here today to talk about the crisis in Ukraine. Doctor, welcome to our podcast.
Hello. Thanks, Sam, for inviting me.
Absolutely. Just as a background, I attended the AAOS in Chicago. I'm actually here right now recording Dr. Haida, and I came across some information in a local publication. I think we're all aware of the devastation in Ukraine and the consequences of war. You're providing some supplies and such to casualties and the staff that are working there. So I was hoping you might provide us a little bit of background on the war and the concerns that we have for casualties that are seen on the field.
Those who have been following closely, like myself, the war really started in 2014. But on February 24th of this year, after Russia massed troops on the northeast and south of Ukraine, they launched a full-scale invasion. And that's been ongoing now. So we're over 4 weeks in. And Russia had some initial gains, but the Ukrainian people have really mounted a spirited defense. And they're defending their homes, their country, but at great cost and expense. They've totally mobilized all the personnel, men, women, all walks of life are defending their homes, but they're defending it with their lives. And if you look at official casualty figures, there's probably around 1,000 deaths official by the UN count, and probably around 1,800 injured. Among the dead, there's at least 110 children. So the costs are tremendous. Now, these are official UN figures. If you look at it a little more closely, that's just the stuff that they can corroborate. The UN acknowledges that the injury rate and death rate is probably much higher, but they don't have access to completely accurate data. If you've heard of the city of Mariupol, which is on the Sea of Azov, they're in a siege right now, and their mayor is saying there's probably over 2,000 deaths, which is not improbable if you've looked at any of the aerial pictures of that city. It's just leveled.
It's just a horrible thing, and the devastation in Ukraine, I think we see it all on the news. Please tell us about the relief efforts that are going on and how you're organizing this and how our listeners might help.
The assistance of the world community is going to be the way this is going to end, and in a reasonable and appropriate way. So I'll back up a little bit. So these casualties in Ukraine are being taken care of in military and civilian hospitals. There are tremendous numbers of them. So any surgeon in Ukraine is now a war surgeon, not by choice, but by necessity. And I have personal contacts among the surgeons there. My friends do as well. And they're saying what I had experienced taking care of U.S. war casualties as a former military surgeon. These wounds are large, they're nasty, they're difficult to treat. And so my colleagues and I here in the States have quickly realized they need help. And the type of help, and they've asked for this help as well, is in our effort is focused on getting the things they need to take care of war trauma. And war trauma is extremity trauma, arms, legs, big wounds, fractures. And so external fixation and negative pressure dressing wound vac, those are means of initially stabilizing and sometimes definitively treating these injuries. And that is what the acute need is right now. There will be ongoing needs as this continues to evolve. And I think we need to realize at present, no large Russian advances, But that also means that the line is more static, and the Russian forces are now using indiscriminate weapons, artillery, multiple launch rockets, mortars, cluster bombs, shelling from their naval ships on shore. And this does not specifically target military personnel. It is a area weapon, and that means more casualties. And they're going to continue to mount, and they're doing what they can to care for them, but it's going to be an ongoing challenge.
Definite need for many items. Dr. Hyde is talking about external fixators and implants, that sort of thing, for fracture care, wound vacs, that sort of thing. I know as PAs, you may or may not have access, but you do have access to your doc's ear. So any help would be appreciated. But they are also accepting monetary donations. So Dr. Hyde, if you please tell us a little bit about that, how they might contribute.
Absolutely. This is going to be an effort by all kinds of people in all walks of life, and do what you think is you're able to do, and what you're willing to do, what seems appropriate to you. But our specific effort, as an orthopedic trauma surgeon, we're targeting the external fixation and the wound vacs, and we're also, through my professional organizations here, the OTA and the Academy of Orthopedic Surgeries, we're also assisting with educational efforts to teach those surgeons how to not relearn the lessons that we learned over the last 20 years, how to best care for them. And if we work on this together, partnering with our Ukrainian colleagues, we can minimize the suffering and really maximize the ability for these patients, these casualties, to recover. And I really appreciate the attention you all are giving us. And feel free to contact me if you have any specific questions or needs.
Absolutely. Dr. Hyde, thank you for your time. And please check out the AUMF.org, which is the American Ukrainian Medical Foundation, where you can learn how to donate and learn more information about the war in Ukraine and what you can do to help. Dr. Haida, I really appreciate your time today. Is there anything else that you would like to tell our listeners?
Sam, thanks again for giving us the opportunity, and together we can overcome this.
Absolutely. Thank you so much for your time. Thank you for joining the orthoPAC podcast. Please follow the Physician Assistants in Orthopedic Surgery on social media. Connect with us on Facebook, Instagram, LinkedIn, and Twitter. Please subscribe to our podcast. If this has been helpful, please take a moment to leave a review.